When you gain visibility, you gain data. When you gain data, you gain insights. When you gain insights, you could do anything.
In God we trust, everything else we track.
Tecsys Children's is the largest children's hospital in the United States. We see several million patients a year. With that number of encounters, there's just a lot of work in the day-to-day, trying to be as efficient as we can with the resources that we have.
Pharmacy has been struggling for many, many years of understanding where we are with our inventory. We've known it for years, we've just never had any tools to solve that problem.
If you wanted to go and look at a drug and know the cost, you had to look it up. If you wanted to go and find out how much quantity was and where it was, you had to send somebody those resources and time. But in addition, you didn't know if it was accurate.
Obviously, without any visibility, we were kind of flying a little bit blind. We had insights into the quantity and amount of inventory we purchased. We knew exactly what we dispensed. We knew what we sent to our expired vendor, and it was about a $40 million gap for inventory that was just unaccounted for. And that could be missing doses, misallocation of product, and it could even be diversion. That's where we needed a solution.
We listened to our supply chain team, had started working with supply chain management. That's when we first met Tecsys.
I asked our internal Pharmacy IS Willow team to look at what Tecsys's capabilities were, and it was largely in RFID and inventory visibility, which was, I think, one of our biggest gaps.
Tecsys generated the back-end software for us. Zebra adjusted their technology on the front end, and that's how we started working out the solutions for the future. Now we have a process where everything is done through scanning, and so that makes it where it's almost foolproof.
We can say, hey, where's your product at? How much do you have of that product? What is the cost of that product? And in addition, what we didn't have before was when medication should expire. Now all that information is there with lot information. With all that information, we make things more cost-effective, make it more efficient, and at the end of the day, it actually is practically better for the patient and patient care outcomes.
We already kind of cost avoided $14 million in procurement of inventory with increased number of patients and medication use. So you're actually decreasing the amount you're purchasing, but you're actually using more.
When I first took over the previous year, our inventory was at $17 million. This last inventory, we were down to $11 million on shelf. Unheard of. We reduced $6 million of inventory. Maybe we're doing a better job of ordering, which is number one, absolutely. You don't order more than you need. But what you also have done is you reduced expired product.
And so there's some of that kind of expired that you would expect in our industry. But to the level that we had at Tecsys Children's and the amount of waste that we created was significant.
Before we went with RFID tagging, nowhere did we track our expiration. So now we have a dashboard. Our pharmacists that manage our high dollar pharmacy takes all those things that are looking at 30-day expiration and moves the stock around to high usage areas. When it gets less than 30 days, we reach out to our fellow community hospitals. Hey, we have this drug, it's gonna expire in 30 days. Do y'all have a use case? Win-win, right? We didn't lose it, and the patients got it when they needed it at the sister hospital. We went down from $3 million of expiration down to less than $200,000 in expiration.
I think we're onto something amazing. Who wouldn't want 100% visibility when you have an app at your fingertips that can tell you all this information? Which hospital wouldn't want that?
What we've done is not only created a system, but we've created a system where now pharmacists trust the process.